right, we're live. Good evening, everyone. Yours truly, Dr. Pierre, favorite. Let me get the introductions out the way. Favorite board-certified internist, host of many things, Medicine Mondays, of course, what you're watching now live with me, Real Physician React. Shout out to Team TikTok, who checks in with me every Thursday evening. If you're catching the podcast episode later on, you definitely should be on TikTok. You should be on TikTok anyways, because, why not? But if you're on TikTok and you don't even want to post anything, because I'm not saying you got to post anything. You could just want to be on TikTok just to be nosy. You should at least check us out. Check me out, right? Thursday evenings, right? We do this 9 p.m. Eastern Standard Time. And this is when we typically will talk about something that comes across my feed, right? Something that just, we got to talk about it. And this week, now, we've done one of these before. As you can see the title behind me, if you're listening to this podcast, I have an article from ABC News. Measles outbreaks are occurring in pockets of the U.S. Here's why doctors are concerned, right? So, and this one actually focused on an outbreak that was occurring in Philadelphia. The article notes that amongst all of the individuals who contracted the measles, guess what is in common with them? They are all unvaccinated. Right, so we can stop there, right? Y'all know, especially if you've been following me, I've been going on a long crusade against this misinformation, disinformation, especially when it comes from Team Anti-Vax. Team Anti-Vax is good for that. Misinformation, disinformation. And here we have a disease, again, for historical purposes. Here we have a disease for historical purposes that was essentially eliminated. This disease was essentially eliminated in our country. Why? Because of the magnificent medical technology of vaccines. But unfortunately, and we'll give a little bit of a history lesson tonight, because I told myself in 24 I'm going to try to avoid talking about these anti-vaxxers. Because I just wanted to bring good energy. Shout out to everyone checking in. Appreciate, hit the like, hit the share button. Appreciate you joining. Appreciate you joining. I told myself I did not want to give that group. I didn't want to give that group the energy unless it found me. Like it found me, I'm gonna give the energy back. But I didn't want to have to go searching for the energy. But of course, when this article, another disease that we have essentially eradicated in this country, or had eradicated in this country because of the vaccines that were available. But unfortunately, and let's give some history lesson. And I think this was, let me make sure I get the date correct, 1998. So again, we're in the year 2024. And this is how, because and I talk to my medical colleagues about this all the time, how when you see someone on social media saying something wild, flagrant, misinformation, disinformation, you have to give it a level of energy so that people around that noise that they done dropped knows that, no, this is BS, right? Because in 1998, The Lancet published a now multiple disputed article that said that the MMR vaccine caused autism. 1998. We're in the year 2024. 26 years later, we are still having to combat against that article that was fake. That from that doctor, it was a doctor, I think it was a bioethicist, who was disgraced, right? Especially in the academic community. 26 years ago, this person decided, you know what? I'm going to put this false article out with false information saying that I see a relationship between autism and the MMR vaccine. We combated that, disputed it, to the point where The Lancet, the journal that it came from, had to publish a whole new article say, guys, that last article we published, that was terrible. That was BS. It was a whole bunch of lies. But unfortunately, once the lie was out there, and we didn't have, especially those in the healthcare community, we didn't have the energy that we have now to dispute misinformation and disinformation like we did. Because what we thought would happen was people would see that article, people were like, all right, that's BS, and not paying any type of mind. We learned very quickly, no. If you see, I think Jenny McCarthy, she was probably one of the more prominent ones back then, who like was championing, oh my God, I knew it, MMR vaccine caused autism. I knew it. And told everyone, because she was a celebrity at the time, so her, and someone said that the lies fly fast, told as much people who was in earshot. And then all of a sudden you had a generation of parents being like, I'm not getting my kid vaccinated with that vaccine. I'm not going to do it because I don't want them to get autism. Even though we disputed it. It was disputed. It was like, it's been disputed so often because we're still having to fight it. We didn't realize how terrible the lie was going to carry, because 26 years later, we are still dealing with outbreaks for a disease that was essentially wiped out with said vaccine. So in this article, they talked about, we had 8 people in Philly, all individuals who came into contact with someone. Looks like they were traveling through the DC airports. I talked about this a couple weeks ago, how holiday season and all of the travel was going to bring the diseases. At the time, we were talking about RSV, COVID, and pneumonia. But again, and now that we kind of recognize, we saw how much they fought against COVID vaccine. So imagine like you have people who are unvaccinated against measles who can now spread it to other people who are also unvaccinated, right? That is a dilemma. That is the dilemma brought to you here. So 2023, according to the CDC, we have had, in 2023, we had a total of 56 total cases of measles. Now, again, that isn't a lot in the grand scheme of things. But the fact that it should be closer to 0 because we actually have treatment for it is where the problem lies. And what gets me, especially when we have a measles outbreak, because this is what, I don't love it, right? I don't say I love when the measles outbreak comes. Any other time, anti-vaxxers will pepper your comments, pepper your videos, tag you in videos about, look what this vaccine did, right? Until we get a measles outbreak. Because right when I get a measles outbreak, I can't see a single anti-vaxxer who's ready to tag me in some video. Not one single anti-vaxxer is ready to tag me in a video to say, oh my God, look what happened, right? Especially because every time there's a measles outbreak, like 99 times out of 10, it's unvaccinated people. But you can never find them. You can never find the same energy that they're willing to give you. And this was always been our concern, right? And I think, here's why doctors are concerned. No, the reason why we're concerned is that we see this continued trend of parents deciding, you know what, based off this misinformation, I'm not going to vaccinate my kids. And then I'm going to be shocked later on when my kids develop measles. I'm going to be shocked again. And I wish I was being hyperbolous. You would be surprised how many people are actually shocked when they're unvaccinated, develop measles, and they're like, oh, like I didn't know this would happen. Yes, because we have a treatment for it, right? Like that's usually the case at hand. So of course, right, like they're silent. And when you see, because you can even see in my comments now, when you see my comments now, there's they're just peppered with excuses other than the fact that say, you know what? Yeah, we kind of messed up there. Right? Like we told y'all don't get vaccinated against MMR based off lies. And even though we have disputed those lies, gotten those lies out of the paint, we're not going to change our mind because we still for some reason think that the MMR vaccine causes autism. Right? Even when and autism, and I tell you, I have a special relationship with autism. I have an oldest daughter who's autistic, my wife is autistic, our youngest son is autistic, right? So I have a special relationship with autism. So of course, right, when I hear lies being spewed about that diagnosis, right, I perk up even more, right? Because I know that we have better testing, we have better availability to recognize, like, all right, what am I seeing here? What characteristics am I seeing? And we have better classification. So it's not as if the number of people increase who got autism. No. It's just the fact that we can actually diagnose better. Like, could you imagine? Let's think about this, right? And I like to think about this in terms of kind of like diabetes because it's usually easier for people to kind of digest. If I had no way to test how high your blood sugar was, right? Let's just say I had no way to test it. And the only way I could test is that maybe if I do an eye exam. Like, that's the only way. And I can tell you, those who are diabetic, you have to be a pretty good diabetic for me to start picking it up in the eyes. Not to say that I can't pick it up, but like it has to be pretty good, along its way. And then all of a sudden, the glucometer machine like comes out of nowhere. And guess what? Now all of these people who I did not know were diabetic, guess what? They are diabetic. So I start saying, oh, now this person has diabetes. This person has diabetes. So that is what kind of occurred with autism. All of a sudden, when we weren't looking for it, when we didn't recognize, like, all right, hey, these are the characteristics, these are the traits that I should be looking for. And instead of putting this person in this class here with this behavior and say, no, this is the issue. No, we said, oh, you know what? They may actually be autistic. And then the numbers rose. But you had people who took that information, seeing the numbers rise and say, oh, no. It was because of this vaccine. So we got to get it out of there. So we deal with 26 years later, we deal with the fact that now measles outbreaks are a thing that just happen. And when it happens, 9 times out of 10, they're all unvaccinated. And 9 times out of 10, they're all unvaccinated. That just happens. That just is what it is. Like all of a sudden, they're all unvaccinated, and no one seems to be especially my anti-vaxxers, that no one seems to be wiser of why they think that is. They're just like, oh, they got measles. All right, let me stay away from them. Let me get away from them. That's so interesting to me when you think about just how misinformation has played such a pivotal role in our healthcare, right? And we're gonna get to the comments. I see the comments, right? Because again, whenever I talk about putting anti-vaxxers, right, to the fire, right, all of a sudden, right, like energy off the wazoo, but usually a whole bunch of lies, right? So usually that's usually the playbook that comes with them. Right. So, of course, we're going to deal with this, right? So I'm looking here to see cases have been identified in Delaware, New Jersey, Washington State. Again, this was just in the past month or so. We expect more cases to arise. Let me see here. Looks like we have about a 93% rate of kids who actually receive the vaccine, which I think is great. Trying to go up to 94, 95% in the past couple of years, especially with COVID. So again, it's not 100%. It's not 100%. And obviously, we're not talking about the people who may have some type of allergy, right? Because and I think that's what, like, what about the people who can't get it's not that many people, but the people who can't get it, obviously, those are not the numbers we're excluding. Or those numbers are typically excluded from that standpoint here. I saw some people say like, oh, well, what happens? Do they die? Right? Like, because that's what people want to know. Oh, do you die? Like, because again, and this is what's so weird to me. Right, when we talked about COVID and we talked about vaccinations, and we would say, hey, you know what? A lot of people can get sick. A lot of people end up in the hospital. A lot of people may end up dying. But they were like, oh, well, how many people? And they would like look at the percentage, like, oh, if only 1 to 3% end up dying, that's okay. That's what they used to say about COVID. So the same thing here, right? When you hear these people get measles, they automatically want to like, oh, did the person die? Well, because if they just got measles, like, who cares? Oh, Frank, appreciate you. Like, who cares? Like, oh, if they got measles, we don't care about that. No care. So this is where we as a healthcare community have to be much more proactive, right? That's why I love what we did, especially during the height of the pandemic, right? Because we recognize, like, all right, like the lies are coming again. Right? The lies are coming again. And if we don't knock these lies out right now, we could have another issue with like we did with MMR. Right? If we don't knock the lies out right now and stomp them out, like I got some great people I follow here on this app who routinely spend their time having to dispute lie after lie after lie. Like and we have to do that because it's a full-time job almost when you're dealing with a side that deals with propaganda, misinformation, just lies, right? Just misinformation. And I always say, especially when we talk about misinformation, right? Misinformation. Let's say I tell you something. Let's say I say the sky is green, and you can't see. Like, let's say you're blind and you don't know that the sky isn't green, but you tell someone else the sky is green, right? Like, that's misinformation. That's you saying, all right, I told this other person that the sky is green because you happen to tell me, but I didn't know. But let's say you actually know the sky isn't green. And not only are you telling people the sky is green, like you're wanting to sell them glasses to show that the sky is green. This is when the disinformation comes in, right? This is when you're willfully lying to spread misinformation out to the general public. Like we see this all the time. We saw this all the time, and this actually, unfortunately, still continues with COVID vaccine, with masking, everything else under the sun. Like that is what it is, right? Like we just see it. Like that's what just happens. So we have been so proactive in it. And again, we have first measles. Let me see. I'm looking here. 1 to 5. I just want to make sure if we have any update on the 8. No updates on the 8. We just know right now a couple of hospitalizations, no deaths. So knock on wood. We're gonna hope that we treat it well, where they're able to make it, right? And of course, right, they'll tell you, hey, you know what? I didn't get vaccinated and I live, so I must be good, right? That's what they're going to tell you that. Like it is what it is. Right? So let's get to some more comments, right? Because what you'll tend to see, right, especially when we talk about anti-vaxxers, right, is they have it's a real short playbook of just lies that they just continue to spill over and over and over again. So we'll just try to see if we can kind of get some of them out of there, just so we can make sure, like, all right, so perfect. Oh, so I love this one, right? So I'm actually scrolling from the bottom up, right? So someone says, Brittany says, natural immunity is always better. No, that is not true, right? That is not true. And when I think about natural immunity, right, this is why I try to tell people, right? Because the unvaccinated 8, right, who were in Philadelphia, they were all unvaccinated. How come their natural immunity didn't stop them from picking up measles? Like, I want us to think about it, right? Like, what was it about their natural immunity that did not allow them to, like, again, let's just think, we don't even have to think scientifically, right? Because I don't want people to, like, try to rack their brains scientifically trying to figure out why their natural immunity didn't stop them. Because, again, all of them were unvaccinated, which means all of them should have had the natural immunity to fight it. But yet, unfortunately, that wasn't the case. So when we think about natural immunity, imagine me saying, hey, I want you to get the disease. I want the disease to cause every issue that the disease can cause to you. And then after the fact, I want your body to build up your immune system so that if you get it again, you'll be able to deal with it a little bit better. Like this is when people say natural immunity, this is the process that has to occur. But what if I told you that you can go through a process where I give you disease, but I don't give it to you in a severity that could cause hospitalizations, that could cause deaths and everything else? What if I told you I can do that without you having to risk all of the other complications associated with it? Like, wouldn't you rather have that? And this is why, this my natural immunity folks, this is what I always ask them. Wouldn't you rather have that aspect? Of course you would, right? You have led yourself to believe that I'm going to skip that process, which is vaccination, which is what I was describing, and give me the disease. Like, I want the full-blown disease. I want my body to have to fight through it. And if I happen to survive, boom, like that's right. So again, that's why natural immunity is not. I'm telling you, is not the best way to go. Right? You don't want these diseases, right? Because you don't want to be. You don't want to have to succumb to it, right? Yeah, and something that says, Larissa, I appreciate all the roses, Larissa. Much appreciated. Vaccination fear is so dangerous. Yeah, like I love this comment here, Kels. Where it's just, and that's really, and mind you, I said 1998 is when that article first dropped as far as this measles one. So this is not a new thing. This is not a new process. In fact, if you look up the history of misinformation, disinformation, they've been doing this for like hundreds of years. When hundreds of thousands of people were dying, even back then with the flu, they're like, I don't know about these vaccines, y'all. I don't know about these vaccines. So we know and understand that this is not a new phenomenon, that people may be afraid of what the vaccine may do, right? Because again, think about that. Again, I can understand. It's a concept that, hey, all right, you're going to give me that disease and I'm supposed to be okay with you giving me that disease versus a possibility of me avoiding it every turn. Like, so I could see how, fundamentally that could be an issue. So that's why it's up to us, the healthcare creators and your doctors and your nurses, right? And everyone who just takes care of you to try to educate you to say, no, this is what happens with vaccines. No, we're not giving you the full-blown disease and hope that, you'll be better. No, we're not doing that, right? There's a process that your body has to go from point A to point B in immunization that we want to help you with this vaccine. But because the fear is so real for lots of different reasons, we can have those discussions too, right? Like, again, I'm black, right? So I can tell you Tuskegee and all that. I can trust me. I know where a lot of people want to go. And it's not like, and I'll tell you, as a physician, I recognize that our healthcare system has not done everybody well. Like, I can recognize that our healthcare system has not taken care of everybody equally and still doesn't take care of everybody equally. Like, we know, I talk about black maternal health all the time, right? Like, I understand that. So that's why it takes those who are now on the inside, even on the outside, to continue to fight, to recognize, hey, I see a problem, but this is the solution, because we don't want people to be left out, right? Like, again, and I always hark back. Remember when monkeypox outbreak occurred, right? Again, non-vaccination, right? Remember when that occurred? Everybody and their mama wanted to try to get that monkeypox vaccine. And you know why? Was the biggest symptom with monkeypox that scared a lot of people was this skin disfigurement. When you got COVID, you weren't worried about your skin peeling. You weren't worried about the aches and pain and itching. You weren't worried about none of that with COVID. But you heard monkeypox could do what? You Googled a couple pictures of monkeypox. You were like, no, when can I get a vaccine? Like the amount of it was such a mind flip to show the amount of people, right, of like, oh my God, when can I get it? When can I get it? Like, it was very weird. So weird. Someone said, Doc, I will find your name. It's in my username, Barry Pierre. Oh, anti-vaxxers are weird. Weird bunch over there. So this is a good question. Someone says, this is the person who's looking for my name. Dr. Barry Pierre. Google it. Do you truly trust pharma companies, Doc? The most corrupt and sued industry that ever existed. One, I don't know if that information is true about the most corrupt or sued industry. I don't know about all that, right? Like, whatever, right? But do I trust it? The answer is yes, right? Yes, I have to trust a system, right, which is pharma companies, right? I have to trust a healthcare system because, again, you have your doctors here, but you have your pharmaceutical, like, again, if you got cancer, you got high blood pressure, you got diabetes, you got high cholesterol, you got erectile dysfunction, right? You have COVID, you have pneumonia, like, you have all of these issues where the pharma companies are amazing, right? But I think a lot of times people hear big pharma, people think this big evil conglomerate that is out there only to do evil acts on the people that, have to use. Like, I don't know what it is, but the association with pharmaceutical industry and evil, right? The association with, and that's something that, again, and obviously I don't work for Big Pharma, but that's something that they got to work on. But I'm not going to sit here and tell you that, like, oh, like, everyone's totally evil. You can't trust nothing. You can't trust no medications whatsoever. Right, like, because that wouldn't make any sense in the world. Because I saw a lot of people posting about Pfizer first, because a lot of people are scared of Pfizer. Again, that's a thing we noticed during this COVID outbreak of how many people like really latched on to Pfizer being like this big like evil monster that they had to worry about. Interesting enough, a lot of men, right, which is ironic, right, especially for those who may not know, right, that one of Pfizer's biggest most profitable medication is Viagra, right? Which a lot of men take, right? And it was almost like I would love to see the Venn diagram of men who are like, oh my God, I can't stand evil Pfizer, and who also took an erectile dysfunction supplement of one way, shape, or form. I would love to see that, right? Like, I'm pretty sure that circle would be very close, right? But like, no, that's I think where the issue is from that standpoint there. Let's make sure we get. Make sure we got that. Someone said, will I find your name on open payments, Doc? Yes. So slow breath meditation is hilarious. So they're asking, will I find your name? Again, mind you, and those on the timeline. This is very typical for anti-vaxxers, right? Because not only do they have a mistrust of the healthcare system, they have to assume that every physician is being bought out by Big Pharma. Again, if you happen to, and that's why I always say all of my lies, if you happen to know some contacts from Pfizer, Moderna, Novartis, if you happen to know contacts, tell them to DM me. I would love to be their spokesman. Hey, why not? If you're going to pay me right, to promote the stuff I promote for free anyways, like, go ahead and do it. But Open Payments is it's a Medicare platform that allows you to actually search your doctor's name to see if they've been paid by pharma for like dinners, speaking engagements, and everything else. Unfortunately, I think I sat at a dinner probably like, it might have been like 4 or 5 years ago, right? I think they gave me what's worse, right? They said they gave me money. It was no money. They just, what they accounted for the dinner. I think it might have been like $30 or $40, man. So I'm definitely on the wrong side of pharma because I'm not on their payroll side, because everyone assumes I'm on the payroll side, but I'm not on their payroll side from that standpoint there. Let's see here. Let's see. So we make sure we're not missing anything. Yeah, yep. Measles, MMR, yep. Let's see here. I saw a lot of stuff from who are primarily government funded. I'm not sure of the question. I'm not sure if it's the vaccine or what that is from that standpoint there. I'm just going back on comments. I for slow breath meditation has been looking for my name for a while. Yeah, just gotta follow the name. Username is in there. Measles part of shingles. No, it's a different one. Shingles, you could, and I saw someone had answered it later, but shingles is in that same family with varicella, which is the chickenpox. So for those who, I'm 40, right? Actually 41, right? So when I was young, we actually got chickenpox. In fact, it's going to sound very weird now. We used to have like chickenpox parties, right? Because if you had one kid who had chickenpox, but the other kids hadn't had chickenpox yet, like our families would get together and say, all right, y'all go play, right? Because one, it was spread by touch, right? Y'all go play because I don't want to have to deal with you having chickenpox right now, right? And then a month later, I got to deal with you having chickenpox, and a month later, I got to deal with, like, now, all y'all get chickenpox right now. That way we can deal with it right now. And I'm telling you, again, fortunately for varicella, shout out to people who've taken the varicella vaccine, right? Chickenpox is one of the diseases. It hurt. It was, you were itching everywhere. Like, it was, I do not wish chickenpox on nobody. You were everywhere you scratch, and it felt like the more you scratch, the more it would itch. Like it was a disease that was typically very limited to the point where it didn't cause you to be severely ill unless you had some, underlying issues. It didn't cause you to be severely ill, but when you got it, just like, COVID, like you had to stay at home, you had to stay in your own room. No one could touch you because it was spread by skin contact. Like you wash your own clothes, own bed sheets, everything else until it kind of went away. And which is why we used to have the parties, because, the parents did not want to have to deal with, subsequent kids kind of getting it back to back to back to back. Because again, if I get it and then I get over it, but then you get it, again, this is a shout out to my natural immunity person. You're hoping that my natural immunity, because I just got it, will make it so that I don't pick it up again. The parents didn't want to have to risk that. So like, nah, everybody, all y'all get the chickenpox right now. We'll deal with from that. Someone said it's due to people entering the country. I mean, there's plenty of people in this country who are sick, because I'm assuming that's an issue related to like immigrants. There's plenty of people in this country who aren't unvaccinated. So like that would be more of an issue in and of itself. Let's see here. I want to make sure I don't miss any. Anyone. One thing about anti-vaxxers, they're hilarious, right? So this person says he puts the doc in indoctrination, right? So again, anti-vaxxers will have you believe that they have access to some information that, like, if you just said it out loud, like, they're the woke people, right? Like, because people think woke is a bad thing, right? They're the woke people. They feel that they have access to information that the general public does not have, right? So it's up to them, right, to let people know, like, oh my God, those doctors, big pharma, oh my, you don't want to mess with them, right? Like that. But a lot of them have that very weird train of thought. And that's why when you have healthcare content creators, physicians, nurses, doctors, of academic standards, like say the stuff like they say, oh no, that's like hogwash. They're trying to brainwash you. Don't listen to them, right? So shout out to the funny, because again, they're absolutely hilarious. Make sure I don't miss any. I want to make sure I miss out any questions. Let me see how many times before. I don't want to keep highlighting. I don't want to keep highlighting the anti-vaxxers, because someone said that China. Nope, China didn't start it. Outbreaks are mostly. Brittany says outbreaks are mostly vaccinated. No, that's incorrect. Every time, right? The measles outbreaks occur. 90% of these people are unvaccinated. The only reason why I'm saying 90 is because I don't want to say 100, and y'all find like the one time where it was like 30 people unvaccinated, one person vaccinated, and then y'all be like, oh, see, you see, and again, and let's, because I want to walk people through that train of thought as well too, right? So those who are unvaccinated or anti-vax will have you believe that it's the vaccinated person that caused them to get measles. I want us to think about that. 30 people could be unvaccinated. One person could be vaccinated, and there's a school of thought from their side that will have you think that it's the one vaccinated person's fault of why they got it, right? They do the same thing with COVID. Oh, when I'm unvaccinated, as long as the vaccinated people stay away from me, I'm fine. Like this, because again, this is how they process it, right? Because they have to live in their delusion of what they think vaccination is and how evil vaccination, big pharma, and everybody else is as well too, right? So, and I don't see any more questions. All right, so yeah, not too many questions. More anti-vax stuff that we'll need to do. So, and someone asked, "Is there a cure vaccine? Measles." The vaccine, right? That just is what it is, right? It's what happens is you get introduced through the MMR vaccine. You get introduced, your body's able to build up your immune system against it. So in case if it ever comes around, I know how to fight it. But if you never introduced to the vaccine, guess what? Now you're walking through the airport in DC, and then boom, now you got the measles, right? Like that's unfortunately, how it goes, especially from that standpoint there. Okay. All right. So we're going to get off, right? Again, like I said, I was trying to dedicate 2024, right, to my peace and my sanity by not having to talk about the anti-vaxxers, right? Because I already know, especially because we're going to get our COVID numbers after the holidays pretty soon, right? So I already know, if we don't already have them, I got to look. I already know they're going to be, up in my comments, up in my mentions. As we speak, like they're tagging me in videos because that's typically how it goes with them. But again, we just wanted to highlight, yes, there is another measles outbreak. Yes, us doctors are concerned. Yes, there's a way to avoid these measles outbreak, but unfortunately, because of the damage that was done, and again, I repeat this, in 1998, because of the damage and the lies that were done in 1998, in 2024, I'm still having to talk about it. 1998, 2024, we're still having to deal with those ramifications, right? So that is why, we are very gung-ho on dealing with disinformation and stomping it out quickly, right? Because we know, especially when you, let's think about the misinformation associated with COVID. I'm not even going to really see a lot of those, effects for maybe a decade or so, right? It may be a decade before we really start seeing the effects of misinformation associated with COVID, right? Like, again, you look at my comments. You have people who are now, 100% against big pharma and natural immunity is the best and all that. That is what happens, right? And then they tell other people. And then they tell other people. And then 10 years down the line, we're dealing with superbugs, right? Because here we are. So y'all be blessed. Make sure y'all make sure y'all follow. If you're trying to catch this episode, it will be on the YouTube channel and the podcast. Link in said bio tomorrow. No, tomorrow, Friday, Saturday. So it'll be there Saturday. But y'all be blessed. Y'all have a great evening.